Welcome to Gate City Chronicles. I'm Kevin Avard, your host, and I'm here with Gateway Community Services. And I want to introduce Peter.
Peter Van Voorhis, Vice President of Community Services.
And Emily Minier.
Director of Consumer Directed Services.
And Michelle Abbott.
I am the Sales and Developmental Manager for Gateway's Therapy Services.
Great. Well, welcome to the show.
Thank you.
Now, we had you on with a couple of other guests earlier, another show, and we're kind of following up on some of the other services that Gateway provides. And if you don't mind, Peter, I'm going to start with Michelle. So you're the big cheese here, so we're gonna work our way up. I don't know if that's proper, but Michelle, you're part of the therapy end of it and marketing.
Yes.
And this is a different service that Gateway offers. So can you talk a little bit about what you market?
Sure.
Yeah.
So for about a year and a half now, we decided to expand services to offer therapies for families. What we were getting back from families is that they were having a hard time receiving services in the community, being on wait lists, whatnot. So we decided to expand our services, which we started with early intervention, 0 to 3, and decided that we would continue services on 3 to 21 years of age. And those services, we're now offering applied behavioral analysis, which is typically geared around individuals with autism, and as well as we're now offering speech therapy, occupational therapy, and physical therapy to individuals.
Okay, and you said you've been doing this for a year and a half. You are actually marketing. How are you going about getting your information out to people? How do they get in touch with you to get either on the waiting list or to get services immediately? How do they do that?
We have a lot of connections with families just because Gateway's community services has been in business for 30 years. We have a wonderful reputation, so we are already connecting with families in a lot of ways. So we are communicating, talking with them, letting them know about the services that we're now offering, either directly from myself or through other departments that are working with individuals directly. We're also talking with schools who might want to complement the services the kids are getting in the school to start offering them on a home-based basis. So we are continuing to reach out to families. Sometimes I spend a lot of time educating families how this home-based service could work for them. What are the benefits of having a home-based service that they probably didn't think about?
Now, somewhere in our conversation, we were talking about Medicare, Medicaid, or something, and how does that apply to your end of it?
So right now, we had Connor's Law that passed, and what that did from a third-party insurance, it covered autism, which only affected about 1/3 of those with a third-party insurance. So if the insurance company had a mandate that they had to cover autism, families are being able to bill their third-party insurance. Medicaid will cover speech therapy, occupational therapy, and physical therapy, but they are not covering ABA, autism applied behavioral analysis services. So families are looking for other sources of funding to have those services in the home.
Now, are you located on Canal Street with everybody else as far as the therapy, or do you go everywhere else? How does that? Where's the location? How does that work?
Our clinic is in Nashua on Canal Street. Our services are split up a little bit different. So we have home-based services for our applied behavioral analysis, or our ABA programs, and then we offer clinic services for physical therapy, occupational, and speech therapy. In addition to that, we also have a program called Parent to Child, and that is in our clinic, and that is focused around children with autism. They come in, they learn a lot of different skills to work with their child. It's hands-on, so the parents are actually physically working with their child, and they're being supervised by a behavior analyst that can help them teach their child. And then they can now bring that home and generalize and continue the training and mentoring for their child.
Are you strictly autism, or?
No, we're not. We do have a large focus because of the population, the epidemic, and the statistics of numbers of kids, but we service all children with developmental disabilities.
Right. Well, thank you. And Emily, you're next. We're going to talk to you, and now you have a specific role for Gateway as well. You're part of the developmental part. Is it?
Yep.
Yeah.
We cover folks who are on the developmental disability waiver or the acquired brain disorder waiver. So consumer-directed services is an umbrella program that or maintains really programs for children and adults. So our children are in home supports, and our adults are in adult custom services.
Now, Peter said there's 300 people that work under your supervision?
Well, the families, what's unique about our programs is that families are able to hire, supervise, and manage their workers within their home. So we have 300 potentially or primarily part-time workers that families are overseeing out in the community.
So that speaks of flexibility with the program, obviously, with them having a lot more control.
Absolutely, yeah.
So I think I asked you before we got on cameras, you see all types of people. They come to you from different stages. Some people that they come out of the hospital, or they even know prior to the, I assume, before their child is born, that there's a situation that they're going to be faced with. And so you see them at all different levels, and you can help at every different level.
We do. They actually come into Gateway's Community Services through our intake. And then from there, depending on where they are in kind of their spectrum or their services, go to specific programs. But we might see individuals who are very young and have been newly diagnosed, and we might have individuals in our adult custom services who really are across the life spectrum.
And you develop each individual program for every person that comes to Gateway?
Not me personally, but our department does.
That seems like that's got to be quite the chore. So
it is. There's a wide array of services that families are that are available to families. So our job is to make sure they have the information that they need and that they are making informed choices. So our job is really to make sure that families know what's available to them for services. But they're essentially directing, supervising, and managing those services within their budget.
what are some of the general questions when people come to you? What are some of the typical questions that they may have when they come to talk to you?
Sure. Can I hire my worker? I have a neighbor who knows my son or daughter really well. Could I make them have them be an employee of Gateway's Community Services? So that's a big one. Our therapy services are available. How can I connect through Gateway Therapy Services if I'm in consumer-directed services? We have different line items that cover various needs, such as respite, because our families are on 24/7 for their care of their sons and daughters. So oftentimes we offer respite to families for their sons and daughters. So those are the types of questions that families are looking for.
Right. Interesting. And that brings us to you, Peter. How you doing?
I'm doing excellent. It's just great to hear about these great programs that they offer.
Well, you're in charge of a lot of it, being the controller, if I may. And obviously you report to Peter at some level.
Yeah.
Yes.
And so I think it alarms me that Michelle was saying something to the effect that there are 1 out of every 85 children. Is that
Right now, the CDC has 1 in 88. With boys being 4 to 5 times more prevalent than girls.
I mean, you start to think, well, is it in the drinking water? Is it what is causing this rightly stated epidemic?
Sure. Well, we all, I think we all obsessively read this information about autism, all of us that are working with the children and the adults with autism, but we don't know of any definitive, cause for autism. I think that's for other people to answer. What we're trying to do at a local level, though, is respond to that. It's very, very real what's happening to our agency and has been going on for some time. And almost every day, I might get a notice of another child with autism diagnosed that's enrolling or already enrolled with a diagnosis of autism, and the requests for services are very intense. People need help.
How big is your waiting list? You said there's a waiting list, and of course we'll talk a little bit about your marketing, but yet there's still a waiting list, but they're separated basically.
Sure. Well, right now, in terms of a waiting list, we have a waiting list for adults, and right now we have 54 to 57 people, I think, right as of today, that don't have long-term funding. I mean, we're trying to find some temporary supports for them, but at this point in time, we don't have long-term funding, and we don't know of an allocation coming their way.
What percentage is funding of state, local, state, private, and federal?
Oh, sure. Well, Gateways Community Services, I mean, the lion's share of our funding is Medicaid, Medicare.
Okay.
And so much of our work is with the different Medicaid waivers that are funded, half by the state and half by the federal government for the populations that we're talking about.
So they're matching funds, basically?
Yeah, they're matching funds. Then for some of the things, I mean, Michelle's working like with the commercial market for third-party pay. They're paying for some autism services. We have private pay for seniors. We have private pay for some of the developmental disability services, and then we have some grant income, but most of it's Medicaid.
Right. Do you envision any future cuts, or how long in advance do you know? Are there going to be increases? Where do you stand?
Well, where we say, yeah. Well, we would certainly hope that that there aren't future cuts, but certainly that's always a possibility. I think every year what we try to do is plan to run the most economical services. That's why, like consumer-directed services, where you come in, you enroll, and we say, okay, you can have this sum of money, but you can make it go further if you manage it yourself. If you supervise the worker and don't need to pay somebody to supervise that worker, you can make it go further. And so what we do is we try to work with the resources we have and make them go as far as we can.
Now, what's really interesting about Gateway is this came along after, when people realized that the institutions weren't working. They were a dinosaur. People were just putting people that had situations that, and putting them into, letting Nurse Ratched take care of them, basically. I'm speaking hyperbolically, obviously.
They were pretty terrible situations.
Right. They were in these big institutions. And so here's a way that Gateway comes along, and now it's a private, basically, or semi-private institution. Am I correct? Or services?
Well, we're private nonprofit, Gateways Community Services,
right.
That's correct. Yes.
And it allows a lot more flexibility, allows people that need the services to stay at home with the ones that they love, rather than being in an undesirable situation, we'll just put it that way, right? And so this is a very economical way of providing the services which have to be provided anyway, and it doesn't cost the taxpayers an enormous amount by institutionalizing them and giving them a quality of life at the same time.
Absolutely. We're all about keeping people home. I mean, that it really is where everyone wants to be, is home. My first job was working on the wards of state institutions. I mean, and like many people, I left that with a conviction that I would make sure there was something else available, because it was not a good. No one would want to live like that. And in the models of service that we're working with right now, we're just trying to do them as economically and at high quality as we possibly can, and have the families and the participants are partners. Let's do it together.
Right. And when it comes to whether obviously this is an election year. One of the things that I think that a lot of politicians on both sides seem to understand is that here is where the most needy people are. And that's where you want to limit as many cuts as possible. And I know that's always, everybody's talking about being fiscally responsible, but this is being fiscally responsible as far as funding this agency. Other than that, the alternative is not that great. I'm putting in my own little political bent on this, because I think that this allowing the people to have services in their home with the ones that they love, I mean, that's critical.
Sure. The longer when we started with consumer-directed services, now 15 years old. I mean, and it was written up recently by the Institute on Human Policy out of Syracuse University, but in their organizational transformation series, where they look at agencies and they say, how did you change over all those years? 15 years ago we said, we have to keep people home. We have to do something different.
Right.
How are we going to respond to all of their needs? Well, if we can make it as economical as possible, and if we have, for example, if one young adult who turns 21 doesn't go on to a residential program and lives at home for another 10 or 15 or 20 years, what are the cost savings there?
Right.
I mean, they're really huge. And what's the quality of life? Well, it's huge. I mean, the family stays together, the individual, assuming that that's what everybody wants and it's working for them, it benefits everybody. They can continue to live on. If we can provide some support, they can stay home. And if we can start earlier when they're children and teach parents and families to care for, to use resources and to run their own programs and supervise their own workers, by the time they get to 21, they won't even want to be thinking about. Because 15 years ago, almost everybody turning 21 was coming to our door saying, well, it's time to move on. I want to go to a group home. I want to go to a residential program for many people. Now today, over half the people, maybe 60% that turn 21, the first thing they do is they go see Emily and her staff, and they say, I want to be in consumer-directed services. I want to take advantage of this program. I want my son or daughter to stay home with me, or I want to help them to move on, but I want to be the one doing it.
Right.
So it's all about keeping people home.
Is there anything else that you want to talk a little bit about your department before we move on to our next segment, which will be about senior care? Is that correct?
Well, I believe Beth and Sharon, my colleagues, are out in the other room. They would come in and talk about that. We would leave, so you wouldn't have the benefit of our company for that as part of the
Obviously not. But is there anything else you want to add to that we might have not covered as far as your departments? How do people get in touch with you?
For me, it's various ways. They either call me. A part of my job description is we've really advanced on social media. Mm-hmm. So we have designed a network for the Nashua region, but it is expanding throughout the rest of New Hampshire now, called the Nashua Autism Network. And what that does is it's bringing families together from a social media standpoint to have discussions, forums, learn about current events. So a lot of families connect to me that way.
Are you on Facebook?
We are also on Facebook now.
Who isn't, right?
I know who isn't on Facebook. So we are also working to actively get individuals connected through Facebook as well. Okay. So we're using both those techniques. We're still using,
Is there a phone number?
Oh, certainly. Gateway's number is area code 603-882-6333.
Are these services, before I end up closing, specifically for New Hampshire residents, or do they go across the border?
For Gateway's therapy services, we do go into Massachusetts. We are serving clients in Massachusetts as well, especially those that have third-party funding sources. We are a provider for those insurance companies, so we are seeing families.
Okay.
Mm-hmm. And for consumer-directed services, it's serving just New Hampshire residents at this point.
Okay.
But I think believe we have a model that's effective and efficient enough where we could be other places.
And they can contact you through the same methods, or?
Yep, and also at Gateway's online website, so it's gatewaycs.org.
gatewaycs.org.
Yep.
I want to thank you all for coming on the show, and we're going to take a quick break, and we'll be right back with our next guest.
Thank you.
Great, thank you.
That's great.
And welcome back to Gate City Chronicles, and I'm here with Gateway Community Services.
Yes.
All right, and we're going to be talking about another services that Gateway provides. And I'm here with Beth Raymond. You're the Vice President of the operation.
Yes.
And Sharon Stevens, and you are the Director of Senior Care.
Gateways for Seniors, that's
Gateways
correct.
for Seniors. Mm-hmm. Well, welcome to the continuing show here. I'll start off with you, if that's okay, Beth. Mm-hmm. Talk a little bit about what we're going to talk about.
Yes, well, thank you. And first of all, thank you very much for having us here. We're thrilled to be talking to you, so we appreciate it. Gateways Community Services has, and fortunately we've been a part of your show for a couple of segments now, and today one of the services we deliver are services for elders. And we wanted to talk to you a little bit about those services that we have. At Gateways, I'm the Vice President of Individual Family Services, and we have 2 areas of concentration for seniors. One of them is our Gateways for Seniors, and Sharon is our director, and the other is our Adult Day Service Program.
Can I talk a little bit about, before we get to you, about the daycare services? Now, this is the situation over at Alvern High School?
Yes, yes.
That's fascinating. And
it is.
I'm sure the viewers are going to like to know about this.
Yes. Well, it's a very unique program for seniors. First of all, an Adult Day Service Program is a 5-day-a-week program for elders or adults who have health care needs that they can go to so that we have a nurse there, we have meals. It's a little bit more supervision and structure for folks. So if you have a person who has early onset of dementia, their caregiver can get a break and the person can go for the day, or if somebody who lives in isolation and could go for a day. So that's an Adult Day Service Program. We're very fortunate to have a partnership with the Palmer Vocational Technical School, which is located in and is a part of the campus for the Alvern High School over in Hudson. And years ago, we were invited to come over. We're a part of that vocational technical school. There is a track for the high school students to be able to learn after 2 years, to be able to achieve a certified nurse's assistant, which is a healthcare certification to do services. And the way that they go to school on one side of the hallway for their classes in certified nurse's assistant, and then what they learn, they bring across and they interact with the participants at the Adult Day Service Program.
So they're learning in real life situations.
Yes.
And they're youthful, and
yes.
And you said they have a good time.
They have a great time. We have probably 20, 25 elders a day in the program, and during the course of the week, 30 of the high school students will come over and interact with the seniors, talking to the seniors. Some of them will be doing blood pressure checks, weight checks. They're actually practicing what they've learned at class with the seniors, and the seniors love them, love the interaction with the young people.
You
they
said
just
there's good
really
food there
enjoy it.
too.
And there's good food. There's good food. The vocational technical school is a really exciting place with a lot of creative things happening, and it's a wonderful place for our seniors to go. We get the benefit of the chorus comes in and sings for the choir, the students' chorus comes in and sings for the participants occasionally. And we're going to have a great big Thanksgiving dinner for ourselves, for the program, and we go down to Checkers Restaurant, where the students who are in the culinary track will prepare the Thanksgiving dinner in the restaurant. And when we get down there, we take over the whole restaurant, so
wow.
We'll all be there, and then we'll have a Thanksgiving dinner that we'll share with all the participants. Some of them will bring some of their family members, some of our staff will go.
Well, like we were saying earlier, that's a win-win for everybody.
It's a win-win. It's a great program, and if anybody is interested in hearing more about it, I hope they'll give us a call.
Before I switch over, how do people qualify for that? Is it just an age thing?
Actually, there is no age limitation on it. If you have a need, then I encourage people to give the program a call. There's 4 different funding sources, including private pay, so that we can help with trying to match them up with one of the funding sources to see if that can help to help them to be able to pay for it. But if they have an interest in the program, it's really a good idea to just call and talk about what your needs are and see if we can help.
Wonderful. And
yes.
Sharon, welcome to the show.
Thank you.
And tell us a little bit about the services that you provide.
Well, Gateways for Seniors is a department within Gateways Community Services, and we do in-home care. So we go into the seniors' home and take care of them. We also take care of some chronically ill folks. We train people for the job. We give them 8 hours of training on how to take care of someone in their home, prepare meals, clean, cook, listen to the person, no matter if they tell you to put your sheets on backwards. We put the sheets on backwards if that pleases them.
Right.
So we train them for 8 hours to get a certification in order for them to work in the home. They have training on communication also, how to talk, Alzheimer's, a little Alzheimer's training, and sensitivity training to different people's lifestyles. So we do a lot of training of our personal care service providers that go into the home. We also have adult family care and kinship care, which I'll talk about a little later. We have two divisions of seniors we work with. One is Medicaid, and the other is private pay. The Medicaid folks come through a waiver, and we do services in their home for them.
What do you mean by waiver?
A waiver is just for the seniors, so it provides in-home care for the seniors. So the seniors may have a nurse visiting them. They may have personal care services. They may have a nursing assistant come in. They could have OT, PT, and other things in their home. So the waiver provides in-home supports for seniors. And we do the same thing, private pay. We just don't use that funding source, but we go out to folks in their home and take care of them. For the private pay, we have a little more flexibility because we're not under so many rules.
Right.
So we can do more of the companionship or getting people out into the public and getting their haircuts and taking them shock.
Is this like an alternative than a nursing home
It is.
or semi-nursing home care, or how assisted living, I guess is?
The waiver kind of started from a nursing home diversion. They wanted to keep people living at home as long as possible.
Right.
And most seniors want to age in place or age in their own home. They want to stay there as long as they possibly can. And this grant allows them to do that, or this waiver allows them to do that. I've been with the program 4 years, and I'm still working with some people that are still living at home. So it's certainly interesting watching them age in place and watching the services change, and we get to grow with them as they get closer to the nursing home age. We do more and more to support them to keep them out of the nursing home.
Are there certain stages, though, which you say, well, at this point, you'll need a little bit more intense care? I mean, do you help people in that situation, or do you just help them? Meaning, if they're to the point where they need constant chronic care 24/7.
That is not this program.
Right. So, but you can lead them up to until the
can.
point where you can't take care of them anymore.
Our goal is to keep them as independent as possible for as long as possible, because the more independent they are, the more they feel that they're in charge, the more they take care of themselves, the better they take care of themselves, and it helps out us.
Do you find that there's a resistance a little bit when, in the beginning, when people are saying, you know what, I could use a little help?
There's a lot of resistance.
Yeah.
I either get called by the senior, it's more rare that I get called by the senior. I mostly get called by the sons and daughters that have seen the senior and says, oh, I think they need some help.
But Mom, Dad, this is going to help you
That's
stay
right.
independent.
That's right.
This is just somebody else making sure in case you trip or you fall or you need somebody to help cooking or cleaning the house a little bit. You know, obviously it's okay to say, you know, that's fine.
It is. And what we like to do most of the time is involve the whole family. So if the sons and daughters call us, we go to the home and talk to the sons and daughters with the parents. And we also let whomever the person is that's making the decision, or all the people, interview the worker. So they can interview the workers, several of them, and decide which one they want, and that's the one that stays with them.
Right.
So you don't have a stranger coming to your house every day, and there's a bond that grows between the caregiver and the senior.
Right, and that's a great alternative to being in a home, you know. And obviously, some parents are separated from their children, maybe 25, 30 miles away. It's just enough distance to cause a lot of worry on both parts. So
and we have people from other states even.
Really?
Yeah, the sons and daughters call us up and say, we went to Mom's over the Thanksgiving and things aren't going so well.
Right. And of course, there are people that don't have children, that this is a great opportunity for them to just have somebody, a friendly face, checking in on them on different levels, right? I'm sure you design this specific to their needs.
We do an assessment, so we talk to the senior to see what they are doing now, what their goals are, what kind of support systems they have. And then we do a care plan that involves different kinds of care. And then we work it out so that we have somebody there over the week. So there's not just one person one day. We spread it out so that they can see the caregiver can get to know the senior, and they look forward to the visit.
Right.
And they usually have things all lined up. As soon as the person comes in the door, they don't have to say much, just what do you want me to do, and they start doing it.
Oh, that's nice.
Yes.
Now, what area do you cover? Is it just Nashua? Is it the greater Nashua area?
Hillsborough and Rockingham.
Oh, wow.
So we
That's,
Salem area in that area too.
you said there was another area that you wanted to talk about.
Yeah, we do have kinship care and adult family care. Kinship care is a program through the same waiver that if you're taking care of your mother or father and you feel that you have to do it as a full-time job and you might have problems working and doing that, there is a way that you can get to be a caregiver and take care of your mother and get a stipend for doing it. And it's not a big stipend, but it could make a big difference to someone that's deciding whether they should be working or whether they should be caregiving, and that becomes a big problem for them.
That's interesting.
And we have several people in that program, and it's worked out really well. And then we have adult family care, which is the situation where, let's just say you have an extra bedroom in your home, and you would like a senior to be living there, and you go through an inspection process and a process to make sure that everybody's safe and knows what's going on as far as the person giving their home up and the person going into the home. And then if the match is good, then you can have a senior live with you and you can get a stipend for doing that also.
Semi-foster, semi-renting out a room.
exactly.
Yes,
Interesting.
yes. And we've had people come out of nursing homes that have been in adult family care and go back and forth, and there's a lot of different programs that can be designed and customized for the person. I also want to say that in-home care, it doesn't have to be just in-home care. When Beth was talking about adult day, if you have somebody that has Alzheimer's or needs more care, the 24/7 or getting close to that, we can combine adult day with in-home services. So somebody could work the hours that they're in adult day, and then we'd have somebody there a little after that until the person came home from work. So we can come up with situations where if somebody is struggling with whether they should work and keep a job or really be a caregiver, we can help them do that also.
Is there a waiting list for, you folks must be busy.
We're very busy, but there's not a waiting list. We can always find workers. We're really happy about that we have very satisfied workers. We just celebrated our 10th anniversary last week, and we had the personal care service workers there. We had a senior choir. We had harmonica players from the senior center. We had a really good time.
Do you hire mostly people in the medical field or just?
We do have some LNAs that work not as LNAs, but work as personal care service providers. But most of them are just interested in seniors, have a big heart, have parents that have gone through the same thing or grandparents that have gone through the same thing. The criteria is they have to be 18 years or older or have a GED or a high school diploma.
Now with seniors, trust is huge. You must have a screening process that has to, weed out the. I'm sure you have to do that all the time.
It's a lot.
Talk about your screening process,
it's
if
a
you
lot.
don't mind.
It's asking an awful lot of the caregiver because they have to pass 2 background checks. They have to pass a driver's license test or driver's license screening, make sure they don't have anything on their record. BEAS to see if they're an abuser, if they're on the abuse list with the Bureau of Elderly and Adult Services.
Isn't that amazing that you have to do it? But that's great that you're doing that, and the wrong people can gravitate.
They can.
To this if you're a thief or if
Absolutely.
if you have that.
They have to go through a physical, so they have to make sure that they're physically fit to do that. There's a screening process that we go through, just talking to them and making sure they're doing this for the right reasons. But the testing is very stringent, and they're using their own car. They're buying their own insurance for the car and using it to transport people. So they have to be a really big-hearted person to even want to do this.
And in order to keep people honest, once they're into the program, you must have some certain guidelines that they can't cross.
Yes. We have guidelines. You don't take a client's keys. A lot of clients want us, here's the keys, just let yourself in. We don't do that. They don't have anything to do with their finances. They don't buy get money and go out and buy food for them. There's a lot of very strict rules and regulations that we have, or policies around that, to keep them honest. And then we talk to our workers all the time, all day. When they leave a client's home, they usually give us a call and tell us how the client's doing. So if there's anything going on that they suspect might be a problem, we know about it.
Right. So that you have a lot of checks and balances to keep the bad people out, keep the good people in, and keep them honest while they're there. What else should we know about this program that we haven't covered?
The fact that we're very flexible. You can have in-home care in 2-hour blocks. So for 2 hours a day, we can come in and do an awful lot in 2 hours. The quality of people that we have working for us, as I said, we celebrated our 10th anniversary. There were people that retired and got 10-year awards. Our average person stays with us 5 years. So we're talking about very quality people that will really help you, make you feel comfortable when you're at work, not have you worried about someone. We field phone calls. If you decide to use us and you want daily phone calls about your parent, we can give you daily phone calls. Anything that you want to make you feel comfortable and that the person that we're looking for is safe, we will do it.
And this is a private company.
We're a private nonprofit organization, and we're run by our board of directors.
It sounds too good to be true, but it seems like over time people have seen how the system doesn't seem to work for everybody, that you go into a nursing home, 6 months later you've used up your entire life savings, and then what? You go into a lesser care or something to that effect, or maybe whatever.
Well,
and so this basically modifies that, keeps you into the community, offers services at every different level with checks and balances so that you can stay home, keep your dignity, enjoy your independence. This is not a commercial, by the way.
That sounds good.
All I'm doing,
we're agreeing with you completely.
Yeah, all I'm doing is just trying to reflect back at you, and it just seems, I'm almost 50. I've seen a lot of people in my life, and I've seen different stages in their lives, and the nursing home, to me, is not the answer for everybody. Maybe some, but I've often been alarmed at how much you save all your life, put away. You want to leave something for your kids. And in 6 months, it's all gone.
It's true.
And the care is not as always, tailor-made, if you will.
Yeah.
Cookie cutter doesn't work for everybody.
That's true.
So, is there anything else you wanted to
Gateways Community Services realized that we've been around for 30 years, and we realized that the kind of long-term support that an elder might need in their home, in the community, is what we've been doing for many, many years for people with disabilities. So we realized a while ago that that this was an area that we thought we could really contribute to the community, that we really had some expertise. Sharon's been talking about how wonderful the program is, and it really is wonderful, and the Adult Day Service program is wonderful. We're in a unique position as Gateways to be able to pull in a lot of other resources and expertise from the rest of our organization. We're well connected in the community. If somebody needs more than what we can do, we're very quick to be able to connect them with what else they need and what other resources.
I like that apprenticeship, though, at Alvern. It
Absolutely.
Seems you can't beat that. That's what everybody's been saying for years. Why can't we teach the kids a trade while they're in high school, so when they get out or in the trade schools, so that they can, at the same time.
Absolutely.
It just works. So.
It works very well.
Yeah.
So we're really pleased with being able to do this for the community and the resources we have. The one thing that Sharon's been doing in the area of caregiving support that's been really fun she's been making some inroads using social media for caregiver support information and reaching out to, particularly to daughters and sons of families. And
everybody's on the social media now, so you
have
have
Absolutely.
Absolutely.
Right. So Facebook.
We have our own webpage, gatewaysforseniors.org, and we have Facebook, and we have Twitter, and we have YouTube, and all kinds of interesting things. If you'd like to see our 10th anniversary party, I think it's worth it. You haven't seen anything till you see an 85-year-old man with a coconut bra and a hula skirt on.
Okay.
All right.
Okay. And with that, well, I want to thank you very much for coming on the show.
Thank
and,
you.
Again, one more time, how do they get in touch with you, people?
The Adult Day Service Program has its own phone number because it's over in Hudson. So the number there is 883-0994.
And if I could say one more thing,
Sure.
the city of Nashua has been very generous in giving us a grant every year for $3,000, and we help seniors, low-income seniors, get things to help them live at home. So they might be shower supports to help you get in and out. They could be a lever handlebar so that you don't have to turn a knob. So anybody that's low income, please give us a call. My personal number is 603-459-2742. So they can call me about that or call me about the program. Be glad to talk to anyone.
And the website, one more time?
Gatewaysforseniors.org.
Well, thank you very much for coming on the show.
Thank you again. We appreciate it.
And thank you for watching Gate City Chronicles. And I hope this segment was very helpful to you. And if you have a need, please give a call. And until next week.